This morning, hazmat crews continue to decontaminate the Dallas apartment of the first person to contract Ebola in the U.S. A female nurse tested positive for the disease Saturday night after officials say she had extensive contact with the now deceased Ebola patient, Thomas Duncan.
There was a breach in protocol.
The CDC says the nurse was wearing protective gear, gloves, gown, and mask, and the infection could have resulted when she took her contaminated gear off.
The care of Ebola can be done safely, but it's hard to do it safely.
The CDC also says 2 procedures performed on Duncan at the very end of his life, intubation to help him breathe, and kidney dialysis, were unusual, both putting healthcare workers at high risk of exposure to his bodily fluids.
I'm not familiar with any prior patient with Ebola who has undergone either intubation or dialysis.
And as the crisis continues, healthcare workers across the U.S. say nurses haven't been adequately trained.
We're hearing that they have not followed proper protocol when we have been asking our hospitals throughout the country to provide us with training.
This as another possible Ebola patient who recently traveled to Liberia is being isolated in a Boston hospital, complaining of aches and headaches. The medical center currently treating the man is awaiting his results, but a spokesman says the chances he has Ebola are extremely low. Meanwhile, more Ebola scares over the weekend. On Sunday, a female passenger who recently traveled to Africa became ill on a United Airlines flight from New York to Los Angeles, but Ebola was quickly ruled out.